Good afternoon, everyone. My name is Dr. Alexandra Ashworth. I'm a pharmacist here in Maryland, and today I'll be discussing COVID-19 vaccine hesitancy. First, I'm going to go over some of the COVID-19 vaccine barriers. Those include hasty development, access to the vaccine, government conspiracy, or the belief that the vaccine will actually make you sick. So the first barrier that we're going to discuss is the hasty development. So there's something called an emergency use authorization, EUA. So this is used when the FDA needs to facilitate the availability and the use of medical countermeasures, including vaccines during a public health emergency or crisis such as the COVID-19 pandemic. COVID-19 vaccines are created so quickly due to years of previous research on related viruses. So this is also not the first coronavirus that we've ever seen. We've actually seen plenty of coronaviruses and been able to research them and study them. That all of those years of research actually went into some of the development of the vaccine making. Also included in this quick development was enormous funding, which allowed manufacturers to run multiple trials in parallel. So most vaccines have to go through animal studies and then human studies. This actually happened a lot in parallel while making these COVID-19 vaccines. They had to so that they could get it done quickly. Then on the next slide, I'll show you kind of the timeline that is used when developing vaccines and why the COVID-19 vaccine was developed quickly, but it was also developed safely. So on this slide, you can see that most vaccines do take years to develop, but scientists created multiple vaccines for the COVID-19 vaccine within a year. So the SARS-CoV-2, that stands for the COVID-19 vaccine. So you see down at the bottom, to the year 2020, it only took 1 year for them to create this vaccine, while other vaccines, the typhoid fever, it took almost 120 years. Meningitis, it took, I don't know, anywhere between, about 100 years. So most of them are taking either 100 years or more, or anywhere from 20 years to 5 years. But the coronavirus vaccine was created within 1 year due to years of research and, again, the enormous funding that we just talked about. Another barrier to the COVID-19 vaccine is access. So prior to the recent months, recent as in this past September, August, July, the COVID-19 vaccine was a little bit scarce, or it was hard to find appointments available for everyone. But now it is widely available in the US. So you can go onto vaccines.gov, you can find clinics, pharmacies, and other locations that offer the vaccine in the US. And everyone who is aged 12 years or older is recommended to get the vaccine as soon as possible. So the next barrier we'll discuss is the government conspiracy. So I've heard everything from the government is inserting tracking devices into us to it's trying to make people sick. I can assure you that there are no tracking devices being inserted into anyone. As a pharmacist practicing and immunizing patients with the COVID-19 vaccine, at least 30 a day, I will say that there are no tracking devices in them. My patients do not come back and tell me that they're sick. They've all been fine and haven't had anyone come in and tell me that the vaccine made them sick. So if you don't believe it, what you read, then you can at least believe someone who is practicing and telling you that it will not make you sick. You won't get actual coronavirus from this vaccine. So some facts I can tell you about the COVID-19 vaccine is that it does not have a tracking device in it, which I already discussed. This pandemic is a race between an increasingly infectious and contagious virus and administering the vaccine, which offer high levels of protection. So This virus, as we already know, has started becoming into variants. It started having basically friends. So now we have to make sure that we're protected against the original strain and its variants. And that's why this is a race, but I do believe that we are doing a very good job at it as long as everyone continues to get vaccinated. Infection rates have shown that those who are fully vaccinated are almost 4 times less likely to get the COVID-19 infection. And then vaccinated individuals are also less likely to transmit the virus to others. So the COVID-19 vaccine has been proven safe and effective. Both mRNA vaccines, which are Pfizer and Moderna, are safe and effective at preventing severe illness and death. And breakthrough cases in vaccinated individuals are rare. So now we'll talk about some of the COVID-19 vaccine benefits. The first one is herd immunity. It's my favorite, especially as a pharmacist, because we do give a lot of vaccinations. It is something that is extremely important, and it is how we can get viruses eradicated from our population, if we're lucky. But it is also how we basically protect one another. The COVID-19 vaccine also decreases risks of severe illnesses or death if one does get infected with COVID-19. The current vaccines have shown effectiveness in protecting against, or at least minimizing, the damage from a Delta infection as well as the original strain. And, again, vaccinated individuals are less likely to be infected with the original strain of COVID-19 and its variants. So they are showing that people who are vaccinated if they are getting sick from one of the Delta variant or another COVID-19 variant, that they are not getting as severely sick. And it's also showing that the mortality rates have decreased in these individuals. So herd immunity, this is my favorite topic when it comes to vaccines. So herd immunity occurs when a large part of the population, the herd, is immune to a virus. So this is achieved 2 ways. So it's achieved either through vaccination or through previous infection. So if you have a population that just got infected with, measles, and now that population is now able to protect other people who are coming into that population who've never had measles, they're offered some protection from these people who have had a previous infection from the measles. The other way this is achieved is through vaccination. The more vaccinated individuals you have against a virus or infection, the more they are going to help protect those who are not vaccinated. So as of 8/15/2021, 51.3% of the US population was vaccinated or fully vaccinated. And then as of September 4th, 2021, so only a few days ago, we are at 53%. So if you look over to the picture, it's one of my favorite pictures. It shows the blue population. So those are your not immunized but healthy individuals. And then you have your yellow individuals. Those are your immunized but healthy individuals. Then you have your red individuals. And those are your not immunized, but they are sick and contagious. So what you see happening is, in the population that is not immunized but healthy, if you have a couple of those red sick individuals come into your population, everyone in your populations gets sick. If you go down to the second picture, it shows, okay, well, now we have a few immunized and healthy individuals in our also healthy population, even though this population is not immunized, the blue people. And you see that whenever the red people come in, that the entire population does not get sick. You actually have some conferred immunity from the vaccinated individuals, and you also have a few of healthy individuals who were not vaccinated, but they are likely just protected by the people who were vaccinated. And then if you look at the very bottom, which is what we hope to achieve in the US, we are working every day to do it, is we are vaccinating more and more people. So the more people you have vaccinated in a population, you have conferred immunity And when you do have these sick, red, contagious people coming in, you actually are protecting the population from it spreading. So you could see to the very bottom picture to the right, once these red sick people come in, only 3 of that entire population actually get sick, and those are 2 of them are the ones who had already had been sick from the virus. So it's a really important concept, and it's something that I really hope that people understand, that it's not just about you, it's about protecting others. And we can only achieve herd immunity if we do it together. So this is definitely a major concept, and it's something that I really want everyone to take home with them. Some other exciting news is, recently, so I think it was August 23rd, the FDA approved the first COVID-19 vaccine. So it approved Pfizer, which is a huge milestone in our fight against the COVID-19 pandemic. As the first FDA-approved COVID-19 vaccine, the public, I believe, should be very confident that it meets the high standards for safety and effectiveness and the manufacturing quality that the FDA requires. I'm hoping that the FDA approval of this vaccine will now instill some confidence in those people who were hesitant to get a vaccine against COVID-19 in the first place. Other exciting news, recent news, is that the FDA has approved booster doses of COVID-19 vaccines. So currently only Moderna and Pfizer have been approved for patients to receive a 3rd dose as long as they received Pfizer or Moderna. The eligible patients currently are those who are immunocompromised, and people who receive Johnson & Johnson, they cannot get a booster dose of either Pfizer or Moderna. It's not saying that they can't get a booster dose ever, but right now they have not shown any safety or efficacy data on patients who receive Johnson & Johnson and giving them a booster dose of either Pfizer or Moderna. So right now it is not recommended. The Johnson & Johnson is currently working on whether or not the patients who receive that vaccine will need a booster or not. Last take-home point is protect yourself, protect others, and get vaccinated. If you have any questions, please email info@namimd.org, and then you can also check out NAMI's COVID-19 resource on NAMI's website, www.namimd.org.